I just couldn't believe that I had gone in for a biopsy and it had turned into this.
I was angry. I don't think they realized how serious it was.
It looked like my flesh was being eaten away from the inside out.
The only thing I could think was, I'm losing my vision and I'm never going to see my child.
I thought she would not live very long, and it scared me to death.
Next, two medical mysteries that defied the experts. When June Pesci goes in for a routine breast exam, little does she realize that in less than 72 hours, she'll be in a desperate fight for her life.
I woke up and was missing 3/4 of my left breast. I could feel my body dying.
Then, when Teresa Racklin experiences bizarre distortions in her eyesight, each day becomes a frightening struggle.
It looked like I was looking through a kaleidoscope. I was terrified.
In the fall of 1999, 36-year-old June Hook had just started working at a local printing plant in Portsmouth, New Hampshire, when she met a man who captured her heart, Kirk Pesci.
I was running a printing press, and she was a customer service rep at the company we both worked for. She had a great personality. I loved her smile, and I just thought she was beautiful.
He'd flirt with me every morning when I was going into work. And then he just started bringing me in coffee, and the relationship blossomed from there.
I was comfortable with her. She was comfortable with me. It felt like we've known each other a lot longer than we actually had.
He was funny. He made me laugh. And we liked doing the same things.
And within 2 years, June and Kirk were exchanging wedding vows before a small group of family and friends.
It was in our yard at our house, and we just had a huge party afterwards.
Over the years, the couple shared an unbreakable bond.
We just loved spending time together.
We had a good time. Kayaking, fishing, all different kinds of outdoor stuff.
June's active lifestyle keeps her fit and healthy. So in April of 2009, when she goes in for her annual mammogram, she fully expects to receive a clean bill of health.
I really haven't ever had any problems in the past, so I just figured it was going to be a routine visit.
But the results are anything but routine.
A mammogram found 2 small masses on my left breast. There was a small anxiety that there could be some cancer.
I was scared and nervous. I've seen several people in my life, die of cancer.
The doctors decided that they wanted me to go in for a stereotactic biopsy, where they go in with a needle and extract the specimens, and they leave behind a small titanium chip so that during future mammograms, they'll be able to tell where specimens were taken from previously. They sent out the tissue for testing and told me that I should hear back from them within days. My biopsy results came back negative.
I was very happy to hear that.
But her relief is short-lived. When June wakes up Monday morning, she's alarmed to see a disturbing change in her breast.
I noticed that there was a painful portion of my left breast, and there was a small lump. It was red and hard to the touch. It was extremely painful. I had a hard time reaching up to the top of the cabinets in the kitchen, and it almost had a tingling sensation like any infection normally has. Lifting things was very painful. Simple things like carrying laundry hurt. It was very frustrating. My husband suggested that I get in to see the doctor. The doctor looked at it and said it was warm to the touch and took specimens from that so she could send out cultures on it. She gave me a prescription for pain medication and an antibiotic.
Despite the week-long course of treatment, the redness and inflammation seemed to spread. And even more troubling, pus begins oozing out from June's breast.
It looked like an infection that needed to be cleaned out.
At that point, the mark was probably a half an inch to an inch across.
Horrified, June schedules an emergency appointment that afternoon.
The breast specialist thought that the infection may have been caused by the titanium chip that they had put in my breast. The doctor took me in for surgery and cut out the titanium chip.
The procedure goes smoothly, and June breathes a sigh of relief.
It seemed reasonable that the titanium chip would have caused the infection.
I thought that was going to be the cure-all to what was going wrong with June.
But nothing could have prepared her for what she sees while she's changing her bandage that night.
It looked like my flesh was being eaten away from the inside out.
It looked awful to me, just horrible. It was a 3-inch gash in her chest. It looked like the flesh was dissolving, and there was pus all around the edges. It was just very, very wrong.
That night was very difficult for me. I had a hard time sleeping that night. I had an open wound on my chest. The pain medication that they gave me really wasn't doing anything. It was extremely painful. The wound had gotten a lot worse just in that 24-hour period. I went back to see the doctor, and she immediately had me admitted to the hospital. They took more blood, they took more cultures from the wound, and informed me that they couldn't figure out what was wrong.
Over the next 5 days, June watches in horror as her painful wound spreads out of control.
The pain was horrific. It didn't feel like anything else I had ever experienced, especially when they'd come in to change the bandages. It felt like they were ripping my flesh off.
I was angry. I don't think they realized how serious it was.
I just remember them talking and arguing with each other, but no one really having an answer. I honestly thought they had no clue. It was like being trapped in a nightmare.
In the spring of 1993, 16-year-old Teresa Ennis walked into a Long Island diner with her friends, just for a burger and fries. She had no idea her future husband was about to join their group.
A mutual friend introduced us, and from the moment I met him, I knew that there was something special about him.
Initially, the first thing that struck me about her was her beautiful eyes. And after I got to know her, I just found out that she was just a great person inside.
We were all about just enjoying life to the fullest.
I decided to propose to Teresa on the beach, and I said, I want you always to be happy, and I want to be happy with you.
Dan and I got married in 2005, and we relocated to Lexington, Virginia.
I was working as an electrician's helper, and Teresa was working in real estate.
I loved my job. I loved meeting new people and visiting new properties.
Life was very good for the Racklins. And in 2007, when the couple finds out Teresa's pregnant, they couldn't be happier.
I always dreamed of having a child.
Teresa felt that her life was coming together, and she was just so excited.
She sails through the pregnancy. But just weeks before her due date, Teresa experiences something very disturbing.
I was at work on my laptop, and I noticed these two spots that looked like two little flies on my screen buzzing around. And then they progressively got larger and larger, and it was shaking. I was terrified, and so I called Dan. I said, something's wrong with my vision.
And in minutes, Dan arrives at her office and rushes Teresa to the local hospital.
And while we were driving, I got this headache in the back of my head and my neck. I was getting really worked up by the minute. I was sweating, I was breathing fast. I was so close to delivering my first child.
I was very scared. She could possibly lose our baby.
The doctor did a thorough exam, and he thought that it was pretty classic for an ocular migraine.
An ocular migraine is a temporary disturbance in vision that occurs when blood vessels suddenly constrict, reducing blood flow to the eye.
The doctor explained that an ocular migraine could occur at the end of pregnancy due to the fact that your estrogen level fluctuates, and they weren't very concerned about it.
I was very relieved that there was nothing wrong with the baby.
I was really happy. It was a temporary situation. My vision would return and I didn't have anything to worry about. About 40 minutes after the start of this, I noticed my vision began to come back. The headache was gone. They told me to just go home and to not work for the rest of my pregnancy.
We went back home and everything seemed to go back to normal, so we were happy with that.
I just stayed at home and got ready for the baby to come.
Just after Christmas, right on schedule, Teresa goes into labor.
When Ashley was born, we counted 10 fingers and 10 toes, and we were just very happy that we had a healthy baby girl.
I was excited to bring her home and have a whole new life with our own little family. My vision was great, and I thought for sure, well, you know, I can put all this behind me and forget it ever happened. I went back to work when Ashley was 8 weeks old. It was pretty hard, but it was something that I really wanted to do. I loved it. Life really couldn't have been better.
Teresa settles into a comfortable routine as the next 8 months sail by. Then, one day in August, she's suddenly hit by a shocking new symptom.
I was at work. When I looked at my coworkers, it looked like I was looking at them through a kaleidoscope. I would see bits and pieces of their faces, like they would have one eye and one ear on the other side of their head. I called Dan and I said, you need to take me to the hospital because I'm losing my vision by the second. We didn't have an explanation now. I wasn't pregnant. This was not supposed to be happening.
I was very concerned at this point. I picked Teresa up and we rushed to the ER again.
The doctors took me in right away and examined me. I didn't know what was happening or what to expect.
The doctors explained to us that there could be a bigger problem, could be something with her brain, so I got very concerned.
The doctor thought, just to be thorough, to do a CT scan to just help rule out anything serious. I thought that there was a chance of having a brain tumor. I just thought, what else could really be causing this other than that? I was really terrified. The doctor came back with the results and he said that everything came back normal. I didn't have any brain tumors. He said some people just have a migraine condition, and once you develop it, you've always got a migraine condition. It was, well, maybe it'll happen again and maybe it won't, and good luck. I was really scared that I may have these forever just because I didn't know how I was going to live a normal life. I knew that I had to kind of ignore them and hope for the best.
Over the following 3 months, the strange visual disturbances seem to come and go at will, and Teresa gradually learns to live with them. She has no idea that the worst is yet to come.
I was driving from downtown to my house, and I realized that something was wrong with my eye. It just seemed like there was a gray line in my vision that was almost like an imprint from a camera flash. It was like a gray, transparent arch. All I knew was that I just wanted to get home.
When Teresa came in the door and told me what was happening, I was very concerned. So we called the doctor and made an emergency appointment to see him.
Dan drove me up to the eye doctor where I was dilated, and the eye doctor looked in and he said, yes, there's something there. It's a cotton wool spot. I'd never heard the term, and he said it's a retinal infarct.
A retinal infarct is an interruption of blood flow to the retina's nerve fibers, resulting in a partial or total loss of vision.
The doctor told me that it was like a little mini stroke that I had in my eye. which meant that there was a cutoff of blood flow to the rest of this little tiny vessel in my eye, and it leaves a marking that looks like cotton wool. The doctor told me that this shouldn't cause any permanent vision loss, but that it could take anywhere from 4 to 6 weeks to resolve itself. I was relieved.
But Teresa's relief is short-lived. The retinal infarct might be a sign of a serious underlying disorder.
The doctor said that cotton wool spots are most commonly found in people that have some sort of an autoimmune disease, and he believed that there was something that probably caused this systemically.
I was very concerned when he first spoke of an autoimmune disease because I know that they could be very dangerous.
The physician suspects Teresa has lupus, a serious inflammatory disease that can attack all the organs of the body.
The doctor ordered a workup of my blood.
The wait felt like forever.
I'm thinking, well, now do I have an autoimmune disease that's going to completely change my life? The thought was absolutely devastating to me. I was terrified.
After undergoing a biopsy, June Pesci has developed a mysterious festering wound that's ravaging her breast. It seems to be immune to antibiotics, and even more baffling to her doctors, not a single test has turned up anything even remotely out of the ordinary.
It was very difficult. I was stressed every day. I didn't know what was going on. My worst fear was that she was going to die.
I honestly believe if I hadn't asked them to be transferred, that they would have let me sit there until I died.
She said, I'd like to go somewhere that can save me, or at least help me.
And at that point, I requested to be transferred down to Brigham and Women's in Boston.
45 minutes later, on-call trauma surgeon Dr. Amy Rizak takes over June's case and is stunned by what she sees.
Her left breast was all dead skin. On the upper, inner, and outer quadrants, it had bluish and black discoloration, and in addition to that, there was some gray drainage from the small opening in her left breast. I was concerned for necrotizing fasciitis, also known as a flesh-eating bacteria.
Necrotizing fasciitis, or flesh-eating disease, is an extremely rare antibiotic-resistant infection that destroys skin, fat, and tissue. It spreads rapidly, and if not stopped, can be deadly.
It was very scary to hear those words. June went in for a simple breast biopsy, and she came out with possibly a flesh-eating bacteria.
Alarmed by the severity of June's condition, Dr. Rizak schedules emergency surgery at 2 a.m.
It was extremely important to act quickly and take her to the operating room.
I was scared that she was going into surgery, but I was happy they knew what was going on.
By removing the dead tissue, we would stop the infection from spreading and to allow any viable tissue to remain viable and not become infected. If we did not do anything urgently, the disease would have progressed rapidly and the patient would have died.
It seemed like seconds were hours. It was horrible just to sit in the waiting room, just to wait for her to come out of surgery to make sure she was okay.
The entire upper portion of June's breast was removed. It was all necrotic tissue.
Groggy from painkillers, June doesn't know just how much of her breast she's lost.
It's a total blur. I was in and out of consciousness. When I was conscious, the things that I remember are when I was having the bandage changes. Where they had done the surgery was excruciatingly painful, even on morphine.
The next 12 hours are critical. If the operation has been successful, June's skin should begin to heal.
At that point, I felt that we were able to get most of the infection out of June's breast and give her immune system a little bit of a chance to catch up.
But soon after the surgery, as Dr. Rizak is checking on June, she's completely taken aback by a frightening new development.
I was shocked to see how much the redness and the necrosis had spread along her chest wall and down to the lower portion of her left breast.
Clearly, the surgery hasn't stopped the terrifying disease. And within the hour, there's another unmistakable sign that the infection is once again out of control.
Her white blood cell count was going up, and she was having high fevers almost continuously.
White blood cells are essential players in the body's immune system. When infection or trauma occurs, the body sends these cells to the affected area to help heal and repair the tissue. But in large numbers, they can cause dangerous inflammation.
The body's inflammatory system just goes into overdrive. Blood pressure gets low, and the patient basically just spirals from there.
I, at that point, really thought I was dying. I could feel my body just shutting down. Everything was just shutting down.
I spoke to the family again and told them that the infection was spreading and she needed another operation.
June is rushed back into surgery, her third operation in 2 weeks.
About 10 centimeters by 4 to 5 centimeters of tissue was removed from the lower portion of the left breast.
Obviously, it was a necessity, and it's something that can be fixed down the road. My biggest thing was I just wanted her to be healthy and come home, whether she had 1 boob or 3 boobs.
Just a few hours after surgery, Dr. Rezac spots something so startling, she begins to reconsider her original diagnosis.
I noticed the necrosis on the IV site and the right arm. It was rare to see 2 separate sites of infection on 2 different sides of the body. That was the moment I realized that this was something else.
With June going downhill by the hour, Dr. Rezac immediately calls in Dr. Clarissa Yang, a dermatologist at the hospital.
I was surprised at how large the ulcer was. She had basically lost all of the upper layers of the skin. I was worried that it wasn't an infection, which was what was presumed in her case. Based on what I saw, we suspected that she had another very rare skin condition.
But the only way to confirm her hunch is to administer a heavy dose of steroids. And if they bring down the acute inflammation, Dr. Yang will know exactly what she's dealing with. But the treatment is a gamble.
If this was actually a rare infection, giving steroids to June would have worsened her infection, and she could potentially continue to deteriorate and potentially succumb to her disease.
Risky as the treatment is, all Kirk can do is take the chance and pray that the steroids will work.
I'm sitting in the hospital and she's fighting for her life. I cried and cried and cried, and it was just killing me. Not knowing if I was even going to have a wife to go down and see the next day.
Over the past year, Teresa Racklin has been experiencing frightening distortions in her eyesight that no doctor can explain. But now, one expert suspects he knows what's triggering her bizarre symptoms. Lupus, an extremely debilitating and often fatal autoimmune disease.
I was scared. I wasn't sure how it was going to impact my life.
Finally, after 3 excruciating days, the findings are in.
When we went to the hematologist, he said that they didn't find anything wrong.
I was really happy to find out that all my blood work came back normal, but I was frustrated not still having an answer.
Over the next month, doctors lead Teresa through a series of specialized autoimmune tests, but everything they run comes up empty.
I didn't know what else to do. On a daily basis, I would have cotton wool spots to my vision. I thought a lot of Ashley because maybe I was sick with some sort of a disease and that I wouldn't be around for her.
Worried and confused, Teresa does the best she can to get through each day. Then, while at work in December, she's blindsided by a frightening new symptom.
I noticed that I got this strange sensation in my ears that was like a loud pitch noise that had just come out of nowhere. Everything started to feel weird. I developed dizziness that was strange. I felt like I was falling to the left, like I was on a boat.
We had no idea where this vertigo was coming from, or the ringing in her ears. It was very, very upsetting.
Teresa returns home, hoping the dizziness and ringing sounds are just temporary. But over the next few weeks, the strange symptoms recur again and again.
It was a battle every day just to maintain a normal lifestyle. And there was this screaming in my ears. It made my head a crazy place. I felt completely alone.
Determined to get to the bottom of her puzzling situation, Teresa consults one doctor after another.
No one could give me answers. I started to question my sanity and thought, is this more in my head than reality?
There were eye doctors, retina doctors, rheumatologists, hematologists, you name it, she was going to them. I thought, won't anyone help my daughter? I thought a break would help her.
I left my job. I didn't know what each day held for me. And I just became afraid of everything.
Teresa was afraid to leave the house with Ashley because she didn't know if she was going to have another episode or partially go blind or lose her hearing. It was really hard for me at times.
The situation became really emotionally exhausting. He was getting really tired of trying to be the strong one all the time while I was completely falling apart. There were days that I would wish that he would just leave me so that he could go and have a good life.
It was very hard, but I married her for better or worse, in sickness and in health.
As bad as things are, Teresa can't imagine the terrifying turn her life is about to take.
It was a beautiful Sunday morning, and the sun came through all the blinds and blinded me for a minute. It looked like somebody had taken white paint to the top right part of my vision in my right eye. I started to really panic. The only thing I could think was, I'm going blind. I'm losing my vision, and I'm never going to see my child again. I was very scared, so I called the eye doctor right away. And he said, I would like for you to come in and see Dr. Tiedemann, who's our retina doctor. When I had arrived, my vision had improved, and we sat down, and he wanted to know exactly what all of my symptoms were.
And as a physician, one of my main goals is to tie together things that may not seem to be related, but often really are. I had been fortunate enough to see other patients who have had this constellation of symptoms.
He said, I think I know what you have. And that was the most exciting words I ever heard in my life. I felt like I could become whole again, and it was the first hope that I've had in years.
For the last 2 weeks, a mysterious, horrific disease has been literally consuming June Pesce's breast. Now, she's been put on a heavy dose of steroids, a dangerous last-ditch effort that could stop the disease before it kills her.
I went in and saw her, and I just broke down crying. She had the breathing tube down her throat. She just was sedated right out of it. And at that point, I was the most scared I've ever been in my life.
But only 8 hours after starting the treatment, June begins to slowly show definite signs of improvement.
The borders of her ulcers were getting better. There was no purplish hue. Her fever, her white blood count, they all were trending in the right direction.
It was the first thing in 3 weeks that had made a big impact. I was ecstatic that what they were doing was helping.
I didn't feel like my body was dying anymore.
The fact that she was getting better on steroids confirmed her diagnosis. June was diagnosed with pyoderma gangrenosum.
Pyoderma gangrenosum is a rare immune disorder that destroys skin and tissue. In a healthy individual, when the body suffers a trauma, white blood cells are dispatched to heal the damaged area. But in patients with pyoderma gangrenosum, too many white blood cells are unleashed, flooding the injured site and ravaging healthy tissue.
We don't understand why patients with pyoderma gangrenosum have this overactive immune response. There is so much of an immune response that comes into the wound bed, it overwhelms the wound bed and actually causes the tissue to die off instead of heal itself. We're not exactly sure of the exact mechanism of why that tissue dies off. That might be too many cells. We have no idea.
When I finally got the diagnosis, I was so relieved that finally someone had figured out what it was and given me some answers.
While she can't know for sure why the disease set in when it did, Dr. Yang suspects the disease was triggered by the very first invasive procedure June had 4 weeks ago.
June went in for a breast biopsy and she developed redness and an abscess formation. Because she has pyoderma gangrenosum, her white blood cells have come to the area and overwhelmed the area to cause tissue death. Trauma of her skin seems to act as a magnet to these white blood cells.
And the procedure to remove the titanium chip from her breast was the next step in the vicious cycle of surgery that perpetuated the condition.
Anytime you traumatize the skin, the disease process gets much worse.
I think that we're causing more damage than good because every time the tissue was cut away, that was trauma to the skin.
I don't think it really sank in until I saw the wound open for myself to realize how far this had spread. It was hard. It was hard.
I just couldn't believe that I had gone in for a breast biopsy and it had turned into this. It was scary.
If there was never a surgery done on the wound, it may have just been an abscess that would have healed or became an ulcer that was still small and relatively manageable.
While June is overwhelmed by the horrific turn of events, she's fortunate to have received her diagnosis when she did.
If the patient is not properly diagnosed, they can die from the disease because they continue to get repeated surgeries, their wound gets larger, and blood pressure falls. Her organs could have completely failed on her.
The harsh truth is undeniable. But more than anything, June now just wants to know how to stop the disease that has been wreaking havoc on her body.
I went into the hospital and I had a little hole in my chest, and I woke up 3.5 weeks later and was missing 3/4 of my left breast. At that point, I just wanted someone to tell me that they could fix it.
Over the past 2 years, Teresa Racklin has been suffering from inexplicable, highly disturbing vision loss and random bouts of vertigo that go hand in hand with a ringing in her ears. Now, Dr. James Tiedemann thinks he knows what's going on and has referred her to neurologist John Susak to confirm his hunch.
When I arrived to see Dr. Susak at his office, he performed a variety of eye tests.
In 1975, I discovered a disorder, and her symptoms fit entirely with that condition. Her symptoms led me to make the diagnosis of Susak syndrome.
Susak syndrome is an extremely rare disorder that affects the retina, ear, and in some cases, the brain. In healthy individuals, blood vessels transport blood and the oxygen it carries throughout the body. But in patients like Teresa, for some unknown reason, the immune system goes haywire. It attacks the walls of the blood vessels, causing inflammation and inhibiting blood flow.
And when these small blood vessels swell, there is not enough blood that gets to the brain, retina, and inner ear, and they cannot function normally.
I was very thankful to hear that there was a name behind what was actually happening to me.
While there's no medical explanation for why or when the disease strikes, it's clear that all of Teresa's symptoms stem from the blocked blood vessels, starting with her ocular migraines.
Ocular migraine seems to be caused by spasm of blood vessels. When the blood flow is interrupted, it's only a matter of a few seconds before the retina stops functioning. Vision loss is very nearly immediate.
And as Teresa's disease progressed, more and more tiny blood vessels in her eyes were affected.
Each part of the retina has a blood flow that is uniquely served by just one branch of an artery. And when a tiny branch of the artery is blocked, it's a tiny defect in vision in the area that's served by that blood vessel.
Eventually, the blood vessels leading to Teresa's inner ears became constricted too, causing vertigo and ringing sounds.
He explained that the fine vessels that bring the blood to my ears would spontaneously close up and cut off the blood flow.
Susac syndrome can have a very wide range of severity. It can be very disabling, and it can cause complete hearing loss, profound vision loss, and other symptoms within the brain.
But while the doctors are confident that Teresa has a mild form of the disease, she's not out of the woods yet.
We ordered an MRI in Teresa because in many of these patients, even though they have the limited form of the disease, they can have abnormalities in the corpus callosum, a certain portion of the brain.
Teresa thought that she was going to die. She was afraid that she could be bleeding in her brain.
I just dreaded waiting for the results. I was scared that something was going to happen to me and that I wasn't going to be around to raise my daughter.
If Teresa had something wrong with her brain from this illness, I thought she would not live very long. And it scared me to death.
When Dr. Susac told me that my MRI was normal, it was just a huge relief.
Monitoring Teresa in the future will help guide us in terms of what might be the most helpful to her if there are changes in her condition.
It's clear now that for both medical and psychological reasons, Teresa is extremely lucky to have landed a diagnosis when she did.
If I went undiagnosed, I'm not quite sure what would have happened to me. It was such a huge relief to know that I actually had something. All my symptoms were very real.
We still had questions about the future and what it was going to bring.
While there is no cure for Susac syndrome, there is treatment available. For Teresa, we recommended steroids, an immunosuppressant, and IVIG.
But the treatments can be risky. Steroids can lead to osteoporosis, and immunosuppressants leave the body defenseless against infection.
I was concerned with the treatment because I was worried that the side effects would be actually worse than the symptoms she was having.
I chose not to start the treatment yet. If my symptoms get worse, then I will start the treatment.
The good news is, for reasons doctors don't understand, after 8 to 10 years, patients with the syndrome often spontaneously go into remission.
He said that I had a really good prognosis, and he feels there's a chance that I could be in remission without any sort of treatment.
With a solid diagnosis finally in hand, Dan and Teresa can't help but wonder why so many doctors failed to put the pieces of the puzzle together.
Susac syndrome is very rare. There's no laboratory test that you can draw to get a diagnosis. There have now been well over 200 cases of Susac syndrome reported in the world's literature, and that only represents the tip of the iceberg.
After enduring 3 unnecessary surgeries in which doctors removed most of her left breast, June Pesce is finally on the road to recovery. The steroid treatment Dr. Clarissa Yang began administering 8 hours ago is working so well, she's going to continue the therapy to treat the rare skin disorder June is suffering from, pyoderma gangrenosum.
Once you initiate steroids, you're decreasing the total number of immune cells to a more reasonable level, and then those cells are now able to help the wound heal. She responded extremely quickly, and her wound started closing.
Amazingly, after just 3 weeks of treatment, June is well enough to go home. But emotionally, she's finding it hard to come to terms with how much of her breast she's lost.
It doesn't look like me. It's terrible.
She was definitely depressed about what had happened.
While reconstructive surgery is an option, there's a downside. Even if June is on medication, the invasive procedure could trigger her disease again.
We don't know whether her pyoderma gangrenosum would recur or whether she would heal normally. And she has to live with the fear that this may also happen to her again in the future if she had any type of trauma or injury. She can get a paper cut and she could develop an ulcer.
As grateful as she is to have survived the gruesome ordeal, June can't help but wonder why it took so long to get a solid diagnosis.
The prevalence of pyoderma gangrenosum is not well known, but it's thought to be around 1 in 100 to 300,000.
Thank God. I ended up going to the one hospital with the one surgeon who knew someone that knew about this disease.
I had never seen pyoderma gangrenosum before. Her specific case was unusual because she presented in an atypical manner.
Fever is rare in pyoderma gangrenosum patients. The white blood cell count elevation in the blood itself is also rare. Pyoderma gangrenosum is typically thought of as a disease that occurs on the lower extremities. So her case being on the chest was unusual.
Today, June is living a full and happy life. While she's still healing, her mind is on the future.
As far as my health goes, I feel good.
I'm ecstatic that I have my wife back. I said we'll get through it and we'll deal with it after. As long as you're home, I'm very happy.
Every day is special. My husband and I spend as much time together as we can.
Today, she is definitely at terms with what happened and knows that down the road, yes, eventually we'll be back to normal.
Are you a good boy, Ryan? I've never really questioned anything that's happened to me. I always think that something happens to us for a reason. And maybe this happened to me because I was strong enough to get through it. And I can let other people know about it.
Today, almost 2.5 years since the disease set in, Teresa is meeting the challenges of her condition with new confidence and peace of mind.
Teresa still struggles with her disease, but she's able to handle it a lot better. Her attitude has changed a lot. She's become a lot more positive. She's a lot more outgoing.
I am definitely more independent than I've been in years now. I'm starting to go out with my daughter and do things that I have never done with her, and my husband and I are very, very strong.
We're a lot more active now. We take Ashley to the park as often as we can, and we do just whatever we can to get out and be a happy family.
I used to take my vision for granted. I didn't know any better. And now there isn't one day or moment that I take my vision for granted, and I'm so thankful every day that I can see my daughter.